My name's Tim Rhoads. I'm a chiropractor, and we're located basically across the street from Price Chopper. You know, we do way more in this office besides just chiropractic. We have a holistic wellness clinic, and we're not for everybody. We're probably not for the guy that just wants to make his low back pain go away, but we are for the people that want to improve their wellness, that are working to improve their lives. And that can be anywhere from they want more energy, to they have a particular problem they want to get away from, to they want to start working out again, to, you know, they want more life and want it more abundantly. So we work with people intimately about creating a holistic lifestyle that creates wellness in their life. So it's not just about getting over your problem, but it's about learning how to stop creating it, if you will, and creating a life that supports health and wellness. And that's really what we focus on here. Especially the people that, and we get a lot of these people that have been to a lot of places and they're not getting any results. We see a lot of people in here that have been to different chiropractors, have been to different health clinics, have been to different medical doctors, and just not gotten the change that they were looking for. In Chinese medicine, we talk about treating the root of the problem and not the branch. A lot of healthcare systems are designed around making the symptom go away. In our office, what we want to do is try to figure out what the root cause of the problem is. And by that, I mean we have an intimate conversation about how you live, what you're eating, how much you're moving around, and treating the root of the problem. The body never makes a bad decision a million out of a million times given the environment that it's in. So we ask different questions here. We want to know why the body thinks your problem is a good idea. It's a very different approach. But it changes people's lives because they not only make their symptoms go away, but it changes their entire beingness when they recover. We look for somebody that is wanting to change, wanting to be better, because it's an active process here. Call us and make an appointment and come in. Your first visit's here generally about an hour, maybe a little bit longer, and we'll sit down. And what I try to do during that first visit is find out what's going on with you, and basically what your expectations are out of a healthcare provider. And that starts it. And we go from there. Everybody's different. Everybody's an individual. That's what makes this practice such a wonderful thing. It's about meeting people's specific needs, and some people change quicker than others. It's our job to meet the patient where they are and to basically shine the light so they can begin to make the changes in their life. It's not if you will change when you change your behaviors. It's when. Because a lot of questions I get are, can you help me? And when people are willing to make the necessary changes and do the necessary work, you can't not get better. You just can't. And people have a lot of fear about not getting better because they've been told that this is a problem that you can't get over. This is a problem that you can just maintain with medication. It's just simply not true. The body is designed to recover. And you just have to create the proper conditions around it. Care is specifically designed for the individual. So how that looks is how you're eating. It's important. How you're moving. And a lot of things people don't think about, how you're moving is a necessary nutrient. And the new smoking is sitting at a desk. That's the new smoking. And how you're moving has to do with how your spine's moving, what shoes you're wearing, the bed you're sleeping in, and how you're thinking. If your thinking is destructive, that becomes part of the conversation. So basically the care is focused on how you eat, how you move, and how you think. Those are the three factors. And of course, we lean into the first two more than others, and we have people like yourself, Jim, that we refer to maybe take a look at some of the traumas that you've had in your life, because past traumas can keep us stressed, and by definition, when you're in stress or sympathetic dominance, your body's not in a place where it can recover. So that's a huge part of it. Some people, when their bodies change, their thinkings change, and I generally can sort through that as we go through the process of recovery. We work with everything from young mothers. Of course, young mothers have infants. We love seeing them. We love getting these children on the right track. So we work with a lot of children. We work with a lot of people. I used to not see a lot of problems until people were in their 30s and 40s and 50s, maybe even 60s. And now I'm starting to see those problems in their late 20s. So there's not an age group we don't work with. We work with infants all the way to seniors. And that's a really interesting question. We work with people that want to get better. If your mother fed you well, you pretty well get a pass till you're 40. But when you're 40, I find that your youth runs out. Your youth is in your rearview mirror. And at that point, you're either going to have to start learning how to take care of yourself, or you start changing your lifestyle to adapt to your illnesses. But the range is the whole gamut from infants to seniors. You change how you eat, move, and think, and you change your outcomes. And we don't think you can work on your life if you don't have enough health. It's impossible to even work on your life and what's going on if you're sick. And if you don't feel good, for me, it's like, if I don't feel good, what else is there? So, if you've had migraine headaches for 25 years that have put you in bed 2 days a week for the last 25 years, my passion is giving you the message that can be different. That's my passion. My passion is helping you get your life back. And people don't know that. People do not know that they can change, because maybe they've gone to a whole slew of other doctors and they've not gotten any change. So it gets stamped in their head, oh, you're not going to get better. There's nothing you can do about this. It's just simply not true. It's just simply not true. A lot of people will ask us if we see a lot of people with autoimmune problems. And it's not that we treat autoimmune problems. It's not that we treat those illnesses. And what I tell people when they ask me, can you help any given problem, is, well, we help people get healthy, and healthy people don't have your problem. It's a simple idea. It's a very simple idea. So we shine the light on areas where the patient can improve. And things change, the ones that are willing to make those changes. I mean, our basic message around here is if you're not happy with how your body's working, come and see us. Let's have a conversation about it. That's basically the message that we have. So, thank you guys.